I will now invite the recording started, and I now invite Maria Jose, our leader of Working Package 4 in the European One Health Antimicrobial Resistance Partnership. Dear Maria Jose, you have the floor. You can start.
Okay, thank you very much. Can you see the presentation?
Yes, we see it and we hear you well.
Okay, perfect. Then, good morning, everyone. It's a pleasure to be here with all of you. My name is Maria Jose. I am a medical doctor and microbiologist by background. I am working at the National Institute of Health in Rome, in Italy. And today I want to take you behind the scenes of what is, I think, one of the most strategic research partnerships launched in Europe in years. The European Partnership on One Health Antimicrobial Resistance. If you have been working on AMR research, or if you are just starting to build your career in this space, this partnership is going to be relevant for you. So let me walk you through it, what it is, why it exists, and how it works. And most importantly, what it means for you. Let's start with the problem we are all here to solve. This is my disclaimer. And we throw around the word crisis a lot of science, but really AMR is one. Let me put some numbers on it. Right now, antimicrobial resistance directly kills more than 1 million people every year, more than HIV and malaria combined. If you include deaths where AMR is contributing factor, we are talking around 4.95 million a year. And without serious intervention, that number is projected to reach 39 million by the 2050. In Europe alone, AMR causes over 30,000 deaths annually within the European Economic Area, and 133,000 across wider Europe. And regarding the financial tools, well, 11.7 billion euros a year in healthcare spending and lost productivity in EU alone. Globally, we could be looking at $1 trillion added to healthcare costs by 2050. And for this, the WHO and the European Commission have both flagged AMR as a top public health threat. And crucially, this is not just a human issue. AMR touches animal health, plant health, food security, and environment. It crosses every boundary we normally draw around our research. This brings us to the global political moment we are right now. And here in these slides, we can see how antimicrobial resistance undermines progress towards several sustainable development goals, particularly those related to health, food security, clean water, and economic growth. It emphasizes antimicrobial resistance as a cross-sectoral threat impacting these global issues. So antimicrobial resistance don't respect the silos we build normally as researchers, which is exactly why the response can't either. And the world is starting to respond. In 2024, at the 79 United Nations General Assembly, world leaders did something remarkable. They adopted a political declaration specifically on AMR. They committed to concrete targets, including reducing deaths associated with AMR annually by 10% before 2030. And that's a political commitment at highest level. And political committees need, of course, a scientific infrastructure to back them up. They need research programs, funding mechanisms, and critically, they need coordination around countries and disciplines. And that's the gap this partnership is designed to fill. But to understand where the partnership comes from, we need to look at this predecessor. And this is the GPIMR. GPIMR is builds on 40 years of work. It is the Joint Program Initiative on Antimicrobial Resistance. We launched it in 2011, and it is a coordinator mechanism for Europe and global AMR research. Over that time, GPAMR funded 186 projects and networks, brought together researchers from 84 countries and mobilized 181 million euros. As you can see, 55% of those projects had an explicit One Health component, which tells you something about where the science was heading. This initiative experience gave the research community a shared strategic agenda and network, and crucially, a set of lessons about what works and what needs to go further. The last call was launched in the 24, and now is starting the first call in this year with the partnership. If you are a young researcher in this room, or there is a good chance you or your supervisor was touched by the GPAMR. And then the partnership we can see is the evolution of that ecosystem. So let's get into what this partnership actuality is. This partnership has a clear, ambitious vision to reduce the burden on antimicrobial resistance. That might sound simple, but it implies a massive scope. The mission is to boost One Health research and innovative, to generate the knowledge and develop the tools needed to better detect, prevent, and treat drug-resistant infection. That means better surveillance system, better diagnosis, new treatments, and smarter prevention strategies. And the value matter here, One Health is the operating principle. The partnership is structured to break down barriers between human medicine, veterinary science, and environment research. The commitment to equality, inclusion, and diversity is also built in from the start, including a specific focus on underrepresented countries and career stage. For those of you at the beginning of your careers, these values are directly relevant to how the partnership will design its goals and support mechanism. So let's take a look at the structure of the partnership itself. Notice how specific this is. The three core objectives tell you a lot about how the partnership thinks about its role. First, enhancing EU synergies and collaboration across One Health sectors and multiple disciplines, no more silos. Second, boosting antimicrobial resistant research and innovation to generate knowledge and develop real solutions. Third, knowledge valorization, making sure that the things that we learn in the lab actually get translated into policy and practice. And all this expect impact maps directly on those stronger evidence for policymaker, more resilient European research area in the face of antimicrobial resistant threats, and a reduction in the border resistance. All this influencing several sustainable development goals. But how big is this partnership? It's a large partnership. We have 33 organizations across 30 countries, including research funding organization, national ministry, research performing organization, and also non-profit, including civil society. Coordinated by the Swedish Research Council, the total project funded stands at 250 million euros, with up to 75 million coming from the European Commission as co-funded. The partnership officially launched in the June 1st at the 25 and runs for 10 years through 2035. This 10-year horizon is important because antimicrobial resistance needs a long-term commitment. You can't support the improvement of the surveillance system, the clinical studies, the research infrastructures, or the data sharing frameworks we need in 2 or 3 years. This partnership is designed with this really in mind. And you can see in this slide the countries that are partners of the partnership with their organization. But I am speaking all the time about One Health. but let's take a moment to unpack what actually means One Health in this context. One Health is not a buzzword. The key insight here is that we cannot understand antimicrobial resistance in humans without understanding how antibiotics are used in livestock, how resistant bacteria move through water system and soil, and how food production chains create selection pressures. These aren't parallel problems. They are the same problem viewed from different angles. So this partnership is specifically designed to support research that spans these interfaces. That means that the research projects will often require collaboration with clinicians, veterinarians, ecologists, and social scientists. If you are an early career researcher, that's a professional opportunity as much as a scientific one. Building cross-disciplinarity networks early in your career. And let's look at what researcher the partnership with actually funds. The scientific compass of the partnership is the Strategic Research and Innovation Agenda. This document was co-developed with different stakeholders and defines the priority the partnership will fund, as well as the underlying rationale. You can find all the things, all the aspects that we are discussing today. And it is a living document that will be updated regularly. The scope covers basic and early stage research. So this is not just transnational or clinical. The partnership target academia and SMEs. So whether you are in the university lab or in a startup, they might be a pathway for you. Collaboration with users, such a partnership, patient organization, healthcare workers, farmers, and policymakers is strongly encouraged, and in some calls could be mandatory. This is the real world science with a direct pathway to impact, including not only antibacterial but also antifungal, and the existing GPIMR network of over 2,000 researchers is a starting point. New research are welcome. So I invited you to check the SRIA online because this is the document to read before apply to the research goals. And how this partnership is organized. This partnership runs 4 interconnect programs, and let me walk briefly through each of them. Of course, all of them are under these 3 areas: prevention, appropriate use of antimicrobial, and innovative treatment. The programs are first, the Research and Innovation Funding Program is what the most researchers will engage with directly. 6 joint transnational calls, roughly 1 per year, and plus 3 capacity strengthening calls. These calls are competitive and open to international consortium. The capacity strengthening program designed for professionals like many of you, support and training, networking, collaboration across disciplines, sectors, countries, and career stage. It represents the partnership investment in the next generation, and this event is part of this program. First, the impact program that ensures that research results do not remain confined to publications. It supports the translation of knowledge into products, clinical practice, and policy, providing dedicated assistance to research navigating this pathway. And for the data exploration program, addresses a long-standing need within the research community: improved data sharing, harmonized data set, adherence to fair data principle, and increasingly the AI-driven exploitation of research output. For early career researchers, the capacity strengthening program is your entry point in this partnership and in the research. And how are these activities integrated. We have 6 work packets with a set of integrated activities organizing into them. This included first the links with the global ecosystem, and second the alignment with the research strategic agenda. But the ones that I want to flag specifically is the facilitate to mobility, career progression, cross-learning between sectors, discipline and countries, and the map and enable efficient collaboration with European research infrastructures. Of course, if you are building your research practice now, adopting FAIR principles puts you in a strong position for the European goals. And let's close with the first concrete opportunity of the partnership. The partnership has already launched a call focused on new treatment to tackle AMR, specifically on treatments and adherence to treatment protocols. This is already closed, but this call gives you a strong signal for what is coming. 5 more transnational calls are planned. So please start thinking now about the consortia you want to build, the scientific question you want to ask her. Reach out your national funding agency to find out about pre-announced call topics and eligibility criteria. And let's wrap up. We have a partnership for 10 years with 250 million euros commitment to tackling about antimicrobial resistance. For those of you early in your career, this partnership is actively looking for researchers who think about disciplinarity and sectorial boundaries. The capacity strengthening program is specifically designed to support you. The calls are competitive with international consortia. It's meaning that the networks you build at meetings like this are directly relevant. So stay connected to the calls, the SRIA update, and the community event. And thank you for your attention.
Thank you very much, dear Maria Jose, for this very interesting presentation. I'm sure that it has already sparked interest from our participants. And of course, everyone, just to let you know that we will share with you all the presentations so you can watch them and study them, analyze in more detail. And I will now invite Maria Eva Fedotovaite from DG for Education, Youth, Sport and Culture from the European Commission. Dear Maria, please, you can start, introduce yourself and tell us more. We are eager to learn more and to make our participants as successful for these calls. Please.
Will do. Good morning, everyone. My name is Maria Fedotovaite. I am a policy officer at Marie Skłodowska-Curie Actions unit within DG EC, and I will try to share my presentation with you in a second. Okay, do you see it? I just need to make it full screen, I believe.
Yes, so we see it. We see it, we hear you, everything works well.
Okay, yeah, wonderful. So the only thing is sometimes there's an issue with changing slides. In case slides don't change, let me know. But so today I will give you a general overview about postdoctoral fellowships action, what it is about, what we offer for researchers as well as institutions. And this way you'll have a better overview what to expect. So first, to start off, what are MSCA, Marie Skłodowska-Curie Actions? It is a flagship program for doctoral education and postdoctoral training. It is part of Horizon Europe program, Pillar 1 Excellent Science. The budget for 7-year framework program for MSCA is around close to 7 billion. And our program is the most international program of Horizon Europe. And the main features you can see on the slide. So who this program benefits? Most, of course, at the center of our actions are researchers. So we focus on research training, skills, and career development for researchers at all stages of their careers. But of course, here we're focusing on postdoctoral fellowships, so more experienced researchers. Our program is open to all domains. It's fully bottom-up. So it just main criteria, of course, is excellence, but you can choose the area of your research freely. It focuses also on international, intersectoral, and interdisciplinary mobility. So we really encourage mobility cross sectors, cross industries, and that can be a lot of times within postdoctoral fellowships also achieved via secondments, but I'll talk about that a bit later. We also offer very attractive working and employment conditions that offer additional training, very generous remuneration. And of course, even though our actions benefit greatly researchers, they are also very beneficial for participating organizations because they have a structuring impact on the participating organizations as well as allowing it to expand their network and meet new partners across the globe. So let's move on to the new slide. Here you can see our main actions. This is just for information because I know the slides will be shared with you. I will not focus on the remaining actions. I will still focus predominantly on postdoctoral fellowships, where we can see what postdoctoral fellowships are about here. So what is the aim here of postdoctoral fellowships? It is to enhance the creative and innovative potential of researchers, holding a PhD via advanced training, via different sectors and different disciplines. And the main aspect of our program, or one of the key features, is mobility, which means that you have to move to another country to perform your research. MSCA Postdoctoral Fellowships also foster excellence through training and mobility, and they equip researchers with new skills that not only relate to their research topic, but they also focus on different skill set that you might require at your future career, whether it's communication, networking. So not only, again, related to the domain that you're researching, but also transversal skills that are very, very important in a highly competitive working environment these days. Also, this action encourages researchers to work in R&I projects in the non-academic sector, which I will touch briefly upon in the next slides as well. So who do the MSc Postdoctoral Fellowships target? As I already mentioned, they are for experienced researchers, meaning that you have to hold a PhD at the call deadline. There is, however, no age restriction. So whether you are a young PhD holder or a bit more experienced researcher, this action is open to you. However, there is a slight restriction, which is we impose a limitation of maximum 8 years full-time research experience since the award of the first doctoral degree. However, there are many exceptions in case you had a maternity leave, parental leave, worked outside academia. There are ways to deduct it. So even though it might have been 8 years since you've already finished your PhD, you still might be eligible. There is a list explaining these exceptions that you'll find in the link at the end of my presentation. So when it comes to nationality, our actions are also open to all nationals of all countries. For European fellowships, so that means that you're coming to Europe or associated countries to Horizon Europe, it's indeed any nationality. When it comes to global fellowships, which consists, basically the fellowships consist of part of research in Europe or associated country to Horizon Europe, and then part of it is going to a third country. So these particular fellowships are only open to nationals or long-term residents of EU member states and associated countries, but of course, researchers in Moldova would be eligible for it as well. And as I already mentioned, one of the foundational principles of MSCA Postdoctoral Fellowships is mobility rule in all our actions. It's not only obviously applicable for postdoctoral fellowships. So what does the mobility rule mean exactly in practice? So the researcher applying for MSc Postdoctoral Fellowships together with the host organization must not have resided or carried out their main activity in the country of the beneficiary for the European fellowships, or associated partner for the global fellowship, so a host organization in a third country, for more than 12 months in the past 36 months immediately before the call deadline. I know it sounds maybe a bit complicated, but I'm happy to explain afterwards. And how does it work? As I already mentioned, our action is fully bottom-up, meaning that it's open to any domain of research. What you need to do as a researcher, you need to find a host institution. So for European fellowships, it has to be a beneficiary based in an EU member state or a country associated to Horizon Europe. For global fellowships, it's a bit more work, let's say, for the lack of a better word, because you need to find a host institution based in EU member state or associated country, as well as host institution in a third country outside this regional area. So for instance, it could be Canada, it could be the US, Australia, South Africa, you name it. What you also need to do is to find a supervisor, so senior researcher at the beneficiary who will supervise you. And what I also would like to mention here that we only accept only one proposal per researcher. So only one proposal per individual researcher can be submitted. In case there are several proposals involving the same individual researcher, only the last one will be counted. And of course, it is the host organization that submits the proposal, but the proposal itself is drafted closely with the researcher. So here you can see a graphic illustrating the differences, further differences for global and European fellowships, so the two strands of postdoctoral fellowships. So European fellowships, the duration is from 12 to 24 months. And as I said, fellows are hosted in a EU member state or a country associated to Horizon Europe. For global fellowships, those fellowships are normally longer. So they are from 24 to 36 months, and there are two phases. So phase number one, let's say, the outgoing phase, where the researcher moves to a country outside EU member state or Horizon Europe associated country for 12 to 24 months. And then the returning phase of 12 months to the host based in EU member state or Horizon Europe associated country. Another thing that I wanted to highlight here, we offer also additional 6 months on top of these timeframes I just outlined in a non-academic sector that in a member state or associated country. It's fully optional, but as I mentioned before, MSA strongly encourages cross sector collaboration, and this is a perfect opportunity for researchers to get exposure at an industry. It does not affect whether you choose to have additional placement in a non-academic sector or not, your proposal evaluation, but again, it's a very, very good opportunity to have cross-sectoral exposure should you so desire. Moving on, here you can see the representation of the remuneration that you would get. So there are two categories of costs that we provide, and our grants are based entirely on unit costs. So these figures represent a monthly contribution. So for the researchers, we offer living allowance that is rather generous, a monthly mobility allowance, family allowance provided you have children or a spouse. We also offer, depending on particular circumstances, special needs allowance if there is a need for a researcher, whether prior to application or in case the need arises during the project itself. And institutional unit contributions that you can see here are divided in two parts. One is for the management of the project that goes directly to the institution. And then another unit contribution for research training and networking, which contributes, again, as the name suggests, for additional training within the fellowship and networking opportunities for the researchers. So this, even though it's called institutional unit contribution, it de facto benefits the researcher as well. And here, this slide I included for your information. These are the dates for the remaining two postdoctoral fellowship calls within Horizon Europe. So the current call is already open. It closes in September. And then we will have one final call in this framework program in 27 that will also open in April and close in September. And in my last slide, I linked a few useful documents that you can peruse at your own leisure to have more information about our actions. And in case you have any questions whatsoever, I'm happy to answer them now. Thank you so much, and I shall stop sharing my screen. Thanks.
Thank you very much, Marie. It sure was interesting, very interesting, even for us who know a lot about this. And I'm sure that all the participants are overwhelmed with the information.
I can imagine. That's why it's good to have slides afterwards and have a look at all the linked documents and to process this information. I fully understand it can be quite overwhelming.
Yes. Dear Tobias, I see you raise your hands. Maria, would you like to take a few minutes to answer now?
Sure.
Or can
I'm happy to because I will not be able to stay until the end because I have other meetings today, but I'm happy to answer questions now if of course there are some.
So we will allow maybe 1 or 2 questions to be answered briefly, and all the other questions we can take it in writing from the chat. You can write it in the chat, and we will ask Maria to kindly answer them, and we will forward you the response. So we have Tobias and Joseph. Tobias was the first one, so I will now try. Tobias, yes, you can unmute yourself. I think you have the rights now, right?
Thank you very much for the opportunity. It's great being here. I'm already excited to see wide polarity of ideas, and opportunities offered by this engagement. That's why when I saw the advert, I applied. And now, from the presentation so far, it becomes a worthwhile venture that I did really apply. However, I have a concern. Your presentation, I mean the last speaker, given the level of possible applicants, and you said the maximum of 8 years post-PhD, then one begins to wonder, some of us who are already experienced, highly experienced career members who are actually trainers in our own right as PhDs and master supervisors, professors or existing trainers of many years post-PhD. Does it mean we don't have a place in this program? I need this to be clarified. And if there is, may we know exactly where we fit in so that we don't become left out in this scheme that I felt is beautiful for us to be trained. Particularly given the context that some of us in the low, medium income countries, I'm a Nigerian, we don't have opportunities of advanced technologies that will help us to perform some of our researches well. This kind of program will give us such opportunity and leverage of being trained in the technology of today in order to become properly equipped to carry out these researches and then bring out results that will impact positively on society, particularly from the One Health paradigm. So please, can you clarify on how some of us more experienced beyond 8 years?
So, indeed, this, as I mentioned, eligibility for researchers is limited to 8 years after the first PhD. However, there is a number of exceptions that I can share with you by an email. Our colleagues at the Research Executive Agency who manage the call have provided a guidance document that can deduct from this 8 years. So let's say you took a parental leave, you were working completely outside academia for a certain time. So this period of time or these years would be deducted from those 8 years, However, in case you still do not meet the 8 years requirement after the PhD with all the deductions and whatnot, you still can participate, of course, as a supervisor. You can be involved in the project in different ways. You just would not be able to be the fellow themselves. We also have other actions that would be suitable for more experienced people. For instance, one of them is staff exchanges, where you remain employed by your current institution, but you can go on a staff exchange. And this action is also open to third countries that fall within the category that you mentioned, just like Nigeria, with low and middle income countries, which would allow you to go on exchange to another institution from 1 month to 12 months as well. So here we don't have such restrictions. You still remain employed with your original institution, but you have exposure in an institution outside your country. That would be in a member state or a country associated to Horizon Europe. So there are other options, but In this particular case of postdoctoral fellowships, given the demand, in the previous call, we received 17,000 applications. So 8-year rule was introduced partially as a demand management measure, but I mean, at this point, there is not much we can do. So the rule remains, but there are many different opportunities, whether it's within this action, you can, again, as I said, be a supervisor, or within other actions as well, such as staff exchanges. So I hope I answered your question.
Yes, so our agenda does not allow for very long questions right now because I was no, it's fine. Thank you very much for answering for answering us. And please, everyone, you can write your questions in the chat. I assure that no question will be overlooked, and we will go through them, and we will come with a reply with an answer later. So Joseph Michael, if you can ask your question briefly in 1 minute or so, please.
Thank you so much, Maria. Mine is very simple. 1, collaboration. 2, I come from a middle-income country, sort of, that's Kenya, and we have poor access to proper research facilities. I'm from the academia university. Fortunately or unfortunately, in my faculty, I'm the only one who has done sort of infectious diseases. So I'm expected to teach and also do research. So then with this issue, the research, no access to facilities. So I'm forced to find a way. I'm forced to more of being locked inside within my institution. I cannot move around pretty well unless I'm doing my short-term vacation for only 3 months. So how will that help me so that I can be able to develop my career, because I would like to proceed for my postdoc, which I've not been able to proceed because of the kind of work I'm having, the workload. Number 2, can this be a way of also developing what we call collaboration between the institutions across the world with my current mother host university?
So just to answer you very quickly, postdoctoral fellowships is a mono-beneficiary action. So there is only one beneficiary, and they would be based in a new member state or Horizon Europe associated country. For global fellowships, there is an outgoing phase where you have an associated partner based in a third country. You are welcome to apply. You can find, if provided you meet the eligibility requirements as a researcher for postdoctoral fellowships, you're most welcome to find a host institution in an EU member state or associated country and apply for a fellowship jointly. So there are no restrictions, but if you want to remain in your institution because you mentioned the workload, then staff exchanges would be the most feasible option. And there you can, it's a multi-beneficiary action where you go on, as I mentioned already, short-term exchanges. You remain employed with your institution, but you go from 1 month to up to 12 months on staff exchanges, and that's how you build collaborative networks. And maybe it can open doors to further opportunities. But for postdoctoral fellowships, I mean, the rules are rather clear. So I'm very short. Again, if you require more information, I'm happy to reply to you in writing. I don't want to take up more time from the workshop, so I will stop here if that's all right.
Thank you so much.
Thank you very much, Maria. Thank you very much. And of course, as I said, our participants, many of them are overwhelmed. Please send us your questions. You also have our email address in the everywhere in the communication, and we will let you know the answers from the speakers. So thank you very much again, Maria. I understand your schedule is busy, so thank you for being with us today.
Thank you, and have a great remaining workshop. Thanks.
Thank you. Thank you very much. So we will now proceed to institutional pitching, potential host hubs for MSCA Postdoctoral Fellowships in the antimicrobial resistance research. And the first on our list is Professor Miguel Castaño from University of Lisbon, Portugal. Please, Miguel, you can unmute yourself, share the presentation. Please introduce yourself, and we are very, very interested in hearing what you have to say, what you have to share. Thank you.
Well, thank you very much. It's a pleasure to be here. Thank you for the invitation. My name is Miguel Castaño. I teach at the University of Lisbon, and I research at the Gulbenkian Institute for Molecular Medicine. We have a lot of experience receiving and sending Marie Curie fellows, and we have opportunity for Marie Curie fellows. We welcome them. it's a little bit of this experience that I will try to share with you as soon as I can. As soon as okay. I think it will go now. You're seeing it, right?
Yes, now we can see it. Thank you.
Now you can see it. Okay, so I'll try to share a little bit of what we are doing and our experience in the Marie Curie program. Actually, we are concerned about the next big pandemics. We are involved in 2 European consortia that you can check. You have the addresses here, so you can see what we are doing in the viral front, but we are also concerned with the next big pandemic. And well, we have heard and we all know about the threats that are involved with antimicrobial resistance and how it will grow. And we are also part of an European project, an international project within Europe concerning antimicrobial resistance. It's a consortium of different countries in a project called Nano2Film. We're studying how nanoparticles can actually penetrate biofilms and actually kill bacteria in the biofilm. In our endeavors, we have now with us Anna Carolina Ramos. She will be one of the speakers in the next section. So you will hear from her directly also what this means and what we are doing. But there are several forms of bacterial resistance, as you know, like metabolic adaptation, like efflux pumps, like mutation in enzymes and transporters. But we are concerned with another, a different kind of resistance. Actually, there are different nuances for the word resistance, but we are particularly focused on biofilms, on the fact that population of bacteria actually cluster and enclose themselves in a gel-like matrix, and this prevents antibiotics from reaching the bacteria. This changes the metabolic status of the bacteria, and so this protects bacteria from the action of antibiotics. And how to reach bacteria inside this gel-like protection is our concern now. And actually, this is a medical concern. We work in a medical school connected to the biggest central hospital in Portugal. So we keep an eye on medical applications. We keep an eye on medical needs. And most of the infections that we find in humans related to bacteria are actually bacteria that are resident in these biofilms, in these gel-like encases. And so it's actually, it's not only an academic, it's not only a scientific challenge, it's something that is badly needed in the clinics. Now, fighting bacteria inside this gel-like environment has particular challenges because there is the access to oxygen inside these biofilms is not the same. The access to nutrients is not the same. pH is not the same all over the biofilm. So there are different bacteria with different status, with different metabolisms in different phases. So the drug that you are using or developing needs to penetrate the biofilm, and it's to kill bacteria regardless of the presence of oxygen, regardless of the metabolic status of the bacteria, regardless of the pH. So these are a lot of demands, of different demands. We use antimicrobial peptides because antimicrobial peptides interact with the membrane or penetrate the bacteria, and they kill the bacteria by lysis, so by disturbing the membrane. or by massive clustering of biopolymers inside the bacteria. So it's a very radical mode of action. It's a very radical mode of killing that is multifactorial, depends on different aspects. So as long as the peptides can penetrate the biofilm and reach the bacteria, okay, it does not depend on oxygen, it does not depend on pH, it does not depend on other factors. So we think that antimicrobial peptides are up to the challenge of killing bacteria in biofilms. So these are atomic force microscopy images of what antimicrobial peptides can do to a bacterium. So this is one individual bacterium, and you see there is this massive destruction. First, it starts with the membrane on the surface, then there is massive clustering inside the bacteria, and we can follow binding of peptides to the surface of the bacteria, measuring the zeta potential. You see here the action of the same peptides on the surface of biofilms. You can see here the bacteria. This is Staphylococcus aureum. Each sphere here is one bacterium. Upon with the action of the antimicrobial peptide, you can see there is destruction, and then you can compare different peptides. Now, the question remaining is whether and how peptides, these molecules, can diffuse through the matrix of the biofilm, through the gel. These are relatively big molecules, but probably they can perform reptation, so that the dynamics enables them to actually kind of crawl inside the gel. And so that's what we are studying. We use mostly spectroscopic techniques. For instance, calcine sterified can enter bacteria. So live bacteria will glow green, okay? If for some reason there is a permeabilization of the membrane and there is release of the dye, the live bacteria that was green will now fade and we cannot see it. So you can incorporate the dye in the bacteria, and if it fades, it means that the bacteria died because the membrane was permeabilized. So there is a phase of uptake of the dye, and if you apply an antimicrobial, for instance, an antimicrobial peptide, there will be leakage of the dye, and so the fluorescence will fade away. This is kind of the approaches that we use. So here you see, for instance, this is the side view of a biofilm. You see here the bacteria glowing green, okay? It remains green in the control, but if you apply the antibiotic, it works, and then the fluorescence fades away. So that's what you see here. If we quantify fluorescence upon the action of the antibiotic will fade away, meaning that the peptide is entering the biofilm, is penetrating the biofilm, and it's killing bacteria because there is leakage of the dye, okay? So we then see for different depths of the biofilm, different times, we compute everything in the end to get the diffusion coefficient inside the biofilm. A good antibiotic will have a very fast diffusion, meaning that it will have a high diffusion coefficient. This is just the way to treat the data. The concept is as before. So we find that diffusion in this bacterial biofilm is 30,000 fold slower than outside the biofilm in aqueous solution. This gives us an idea of what we are talking about. And then we have means to compare different antibiotics. So this is basically mainly what we are doing now. We are grasping the fundamentals of diffusion of molecules inside the biofilms. Our past experience throughout the years had the contribution of different people that had actually Marie Curie fellowships over the years. The common factor is that all these people had and succeeded in international careers. Sonia Henrique, she started with us. She went to Australia. She came back. She was in different places in Europe, and now she's a tenured professor in the University of Queensland in Australia. She is originally Portuguese. Okay. Second example, Ana Salmeia Veiga. She also started in my lab, then she went to the United States. She came back and she has a very, very successful career from the interaction with the United States group. Then a new technology was created. It was a peptide, exactly. So she invented actually this peptide, this sequence that is an hydrogel. It was published as an academic study. First, this is the paper, but the technology was later developed by a company that was formed. There was an entrepreneurial path along this process, and the technology was recently approved by the FDA. It's now used in the clinics as an hydrogel to protect diabetic foot ulcers. So this is also a nice story of an academic work that turns into a very nice technology, a very good technology that is now being used in the clinics against the biofilms in wounds. And the third story, you will hear it live. It's Ana Carolina Ramos. She was born Brazilian. She's now with us, but she's one of the success stories that you will hear in an hour. So to wrap up, I would say that our experience in receiving Marie Curie Fellows, our experience in sending Marie Curie Fellows, and then receiving them back because they went outside Europe and they return. I say that the fellow, in my view, the most important quality is to be proactive and with initiative. I mean, you cannot sit and wait. You have to look for opportunities and you have to have ideas. Moreover, you have to be able to show that you are a very active citizen. So it's not only about science, it's about being active and being willing to deliver to society whatever you are working in. It doesn't have to be a tool or a technology, but somehow you have to be able to share with this society what you are doing and your contributions. Very important also, a right two-way fit fellow host. I mean, if you're going to a place, if you want to go to a certain lab to work as a Marie Curie Fellow, you have to be able to demonstrate why the host needs you and benefits from you, and also the reverse. How will you benefit from that host? So it's not just any host, okay? It's not just any fellow. It's the right fit between the two. This is very important. You will have to be able to demonstrate this for the reviewers. It's also preferred that you already have some degree of international or interdisciplinary experience, not mandatory, but if you are able to demonstrate that you are comfortable with international mobility because you did Erasmus, because you have been in a internship somewhere else, that is, of course, a plus. And also very important, invest time and commit to the application. It's a very competitive process. Plan in advance, have clear ideas about what you are doing or what you are applying to. Don't do it in the last minute. If you want to, if you don't know, if you don't improvise, okay? Mature your idea for the next phase. For the host, of course, the host must have the capacity. So the host must demonstrate that it has the right instruments, it has the right space, it has the right know-how to perform the research work as planned. This is obvious. Also, the host lab must also demonstrate that it's more than science, that the host lab has mechanisms to share with the society mechanisms of communication, scientific communication, for instance, that you have mechanisms to welcome foreign students, for instance, that you are prepared for language barriers, and so that you have a capacity that expands beyond the science and beyond the benchwork itself. So again, the right two-way fit between the fellow and the host. So the host has also to demonstrate how it will benefit from that fellow. Okay, what is this fellow bringing new, and what is it that you are giving to the fellow that enriches the fellow? So how will you both mutually benefit from this marriage, so sort of say? So also, if you have an international environment, demonstrate that it's supportive of foreign researchers. So it's the barrier language, it's family. So several of them have family integration. Are there mechanisms to integrate foreign people? For instance, what are you doing to improve their network so that they feel at home? All these aspects matter. Also, the host lab has to invest time and commit to the implication. It's a very competitive process, so improvisation is good as an add-on, but cannot be the core of the process. So, and finally, the outcome. What is it that you benefit? Well, it's a very prestigious label. So if you are a former Marie Curie Fellow, that works as a seal of excellence, and so it really improves the prospects of career for the fellow. I know this from experience because we have had a lot of fellows in the lab. So I know it's very important to start a career to have this seal of excellence. And of course, the outcome should be the advancement of science. Whatever you do, you have to share with the others so that you build on science, of course, and it has a societal impact as strong as you can. So sometimes it's only sharing what you do, like you go to European Researchers' Night and you share, you write papers in mass media communication, and so you share what you're doing. But sometimes what you're doing has really a societal impact. In health, for instance, we work with patient associations, and depending on the field, sometimes we get a very strong societal impact. It does not happen always, but when it happens, it's very, very rewarding. So I thank all the people I collaborate with throughout the times and with different collaborations, mainly in this biofilm area. And I thank you all, and I'm open to your questions if we have the time. Thank you very much.
Thank you very much, Miguel. It was very, very informative, very interesting. And I myself, being a chemist, when I see the graphs and the formula, it's just, it's such a joy for me, you know, to see these things that you sometimes lose them when you work in administration. But it has been a joy to my heart to see this. Thank you very much. We do not have now time for questions. We would like to ask you if you could join us at the end of the event. Then maybe there will be questions for you. Otherwise, people are encouraged to write their questions in the chat. And if we have some questions for you specifically, then we will address an email and kindly ask you to respond. Thank you very much, and good luck. Good luck with your outstanding work that you are doing. And I remind everyone that we will have the fellow Ana Carolina Ramos talking a bit later. So it's going to be very interesting to hear her as well. Thank you very much. And I will now invite Pedro Dorado Morales from Institut Pasteur, France. Dear Pedro, please unmute yourself, share the presentation, introduce yourself, and we are looking forward to the presentation.
Hello, good morning. Can you hear me well? Yes.
Yes,
Okay.
we hear you.
Okay, perfect. Let me share the presentation. Okay. Can you see it? Yes.
Not yet.
Not yet. Maybe now you can see my screen.
Yes, now we can see it. If you would kindly put it in, yes, like this. Thank you very much.
Okay, perfect. Well, first of all, I would like to introduce myself. My name is Pedro Dorado Morales. I'm a postdoctoral fellow in the Institut Pasteur in Paris, where I work in the bacterial genome plasticity unit specifically. Today, I'm going to present a bit like the institution itself, and then I'm going to give like a very broad overview of the project I've been developing, and I'm going to also give you also like a general view of the group itself and what they do. So first of all, we are located in Paris, France. This as well in the beautiful city of Paris, and we work at the Institut Pasteur, that is quite known, I think, internationally because of the work is developed here in vaccines, among other things. What I wanted to tell you is the Institut Pasteur is like composed by 13 different departments, 143 groups, research groups, 32 platforms to support the work of these groups, 4 collections of bacteria, cyanobacteria, etc. We are composed of 15 different reference centers in which we receive like samples from all over the world, like for example, enterobacteria, and from the pest outbreaks and so on. The people working here only in the campus of Paris, there are more than 3,000 people working here from 93 different nationalities. And just to let you know, this is what I talk about is the Institut Pasteur in Paris, but actually the Institut Pasteur, it belongs to an international network that is around the world, all around the world. You can have like different centers that are like marked in the map, as you can see here. So it's a big network, and I think it's a nice space if you want to do like really interesting science, because you can find like almost any topic you like. More focus now on antimicrobial resistance. That is at the end of the day what we came to talk about here. I'm going to talk about 3 different like activities that actually are developed in the campus. The first one is the organization of different symposiums related to antimicrobial resistance. This one I mark here actually happened like a couple of weeks ago, but they are like organized like quite often, and they bring not only like the people working on campus, but people that are expert in the field. So I think it's a very good place to network and also like connect with the scientists in the field. Also, I would like to highlight that we host weekly departmental seminars that they happen, as I said, every week, and we bring invited speakers either from Paris, from France, and from all over the world to talk about the work. And last but not least, I would like to highlight the work of PhD and postdocs that organize a group of seminars that are focused on mobile genetic elements that are one of the main drivers of antimicrobial resistance, as you all probably know. So that is in general like the institute, but what about like the opportunities to actually do research and collaborate? Here I have like just pasted 2 of the grants that are now open, and in which you can, for example, look for partners to apply for different funding. And these are, I mean, I just took like 2 different examples, but you can find like more and more, because we have a grant office that is dedicated to actually find these kind of opportunities and try to connect different scientists that might be interested in the, or might be working in the topic, and you might actually like have some synergy with. So this is in general the overview of the project, but I'm going to focus now more specifically in the team in which I work. I work in the, as I said before, in the genome plasticity unit led by DMSL. We have like different research lines within this unit. In my case, I work on conjugative killer plasmids that they will develop later on, so I will not talk more about it now. Then we have like another group that is led by Alexander Kaminsky, in which they work on phages that actually they don't have the typical AGTC genome, but they have modified bases that gives the phages like advantages over the classical ones. Then we have, for example, like 3 other different lines of research. I'm going to describe them briefly, all of them. We have the one led by Marie Skłodowska-Curie, that she works on the domestication and maintenance of multi-parted genomes. What does it mean? Like usually when we think of bacteria, we think of a bacteria with a single chromosome. So we have like, I don't know, the most classical ones, but actually that is not the reality for all bacteria. There are some, like for example, Vibrio cholerae, that has like 2 different chromosomes, which are coordinated. And if we go broader in the tree of life, actually we find several bacteria that actually they fall into this category. And this is the work of Marie, actually trying to disentangle how these bacteria coordinate the segregation, the replication, and trying to characterize these multipartite genomes. On the other hand, we have the group of Celine Lut that actually works on integrons. Integrons are mobile genetic elements, and basically they are like platforms that they stockpile like different functions, like for example, antimicrobial resistance, and they are trying to characterize how these complex platform actually work. And last but not least is the work of Julia Bost, that she works on bacterial response to stress with a special focus on extracellular vesicles. Now, I'm going to talk about my project and about the line of research in which I work. This has been recently published as a bioarchive that you have here the title in case you want to have more information about it. And this has been like the central axis of my Marie Curie fellowship. So as you all know, antimicrobial resistance is a big issue nowadays, because when we treat a given population with antimicrobials, we don't only target the population that actually want to, but the whole population. And that leads to the selection of resistant strains that are no longer like sensitive for these antibiotics. This is why more and more we are looking for a specific like tools or specific compounds or specific agents that are able to affect exclusively the bacteria we want to target and eliminate. And that is what we intended to do here in the project I work with. So what we tried to do is to develop a conjugative platform, so a plasmid basically that is able to efficiently disseminate across the microbiota without perturbing or doing it as least as possible like non-target microorganisms. And then when it reaches the pathogenic bacteria or the bacteria that we want to modify or want to eliminate, actually produce this modification or this toxin in this case to remove it. And how actually we pretended to do that. So first of all, we wanted, what we did was to develop like toxin systems against different multi-drug resistant pathogens that were listed by the World Health Organization as priority. In this case, we focus on Salmonella enterica, Shigella species, and bacteria that carry the multi-drug resistant plasmid Pioxa48. So we develop these systems, validate them, and then we need a way to actually disseminate these toxin modules and to actually reach these multi-drug resistant populations. So for that, what we did was to take a model plasmid, in this case AP4. The name is not important, but what we did was to streamline it by removing the antibiotic resistant cassettes that it carried and other elements that were not needed for the dissemination of the system. And then we added like other features to actually improve the dissemination and the maintenance of these plasmids. Like, for example, as I mentioned here, the FOS locus or the diphorpilus of the plasmid R64. The first one, the FOS locus, actually what it did is to give a selected advantage to the bacteria that carry this plasmid, and that way they will, this plasmid, these two actually will be kept at the population level and will be able to reach the pathogenic bacteria the moment they enter into the microbiota. And in the case of the diphorpilus that I mentioned before, actually what it allows is this plasmid that is very efficient in the dissemination in solid media to be able to disseminate in liquid conditions, which is important, for example, in aquaculture, but also in the gut, because as you all say, the gut is not solid, not liquid, but something in between. So now this is the theoretical like framework that I did, but I want to give you like a more real example, so actually you know what I'm talking about. So for that, I'm going to explain you the case of Shigella. For what for this, what we did is actually like to analyze the genome of Shigella fleissneri and try to find like genomic regions that were exclusive of this pathogen. This Shigella is basically an E. coli that has something different, and this something different is a megaplasmid that is called the PINV plasmid, because it's the one responsible for the invasion process of this pathogen. Within this plasmid, we find a transcriptional regulator that is called BRF that controls the promoter of the BRB gene. So actually, we exploited this genetic circuit to actually like generate a toxin module that is controlled exclusively by the transcriptional factor that is exclusively located in Shigella. And what you can see here is that at 30 degrees, this system is off in Shigella. So that will be the perfect control. And what you can see here is different species of Shigella and E. coli as a control. And when we treat them with this plasmid able to disseminate without the toxin and carrying the toxin. At 30 degrees, we have no effect at all because the system is off naturally, because it only turns on when the Shigella enters the body. But then when the system is at 37 degrees, what we see is completely different. What I mean is that when we don't transfer the toxin, we have no death at all. In the case of E. coli, not even with the toxin, because it's specific of the pathogen we want to target. But in the case of all the Shigella species, what we see is that actually when we don't transfer the toxin, we have cell viability. But the moment that we transfer the plasmid carrying this toxin, we see that we lose viability of the cells. So this was just to show you how the system actually works. It's way more complex, and if you want to discuss about it, I will be happy to do that later on. But for now, I'm going to focus in what I think is also very important for this talk, that is the Marie Curie Postdoctoral Fellow applications. So they asked me to actually give some recommendations and practical advice. So from the point of view of the person that is going to apply, what I think is very important, first of all, is to identify labs or groups that has topics you are actually interested in. So browse all around Europe and try to find the labs that has a topic you actually like. And then reach out to them and see if there is mutual interest, because usually like these labs are looking for people to actually apply to these goals, but maybe they have already too many people. So do that as soon as possible to identify these groups and reach out to them. Then see if you actually check for the eligibility as they said previously. So there is a mobility rule, so you need to change countries to actually be able to apply, and also the career stage. So I don't remember exactly the number of years they said before, but this is good that you know that you actually fall within the applicability criteria. Then something that I think is really important, at least in my experience, is to start writing early. The moment that you have a lab that is interesting, actually, you already reach out and they agreed, you are eligible, start writing as soon as possible, like month before the deadline. As they said in the talk before, improvisation is not a good tool. Actually, you have to do this way before in advance. I mean, there is plenty of applicants, and I think the sooner you start preparing the presentation, the better, because it will maximize your chances of actually succeeding in the application. If you can, this is optional and it's not always very easy, try to get your hands, like try to get an application that actually was selected before, because that will help you to actually like establish, to know how actually elaborate a proposal that actually works, and that is always useful. If you can also, but that will depend of your host institution. Sometimes if they have a grant office or people that are responsible for managing grants, they can help you preparing these proposals. So if that exists, please take advantage of that, because they have done this work like 1,000 of times and they know how it works. So even if you are very good writing and so on, they know the ropes and they probably can give you very useful tips. And last but not least, the moment that you have it prepared, ask a colleague to read it, because they will give you feedback. They will give you like some important points you haven't think of, and that's always useful to have an external point. Sometimes we try to be so focused on what we are doing that actually we forget the big picture. So people from the outside, they can give you very useful feedback. They can tell you if it's easy to understand. They can because sometimes the person that is going to evaluate your proposal will know about the topic, but they will not necessarily be an expert in that topic. So please, if you can, ask people to do it. So that's why I said that if you can start preparing way before the deadline, all the better, because you can actually have like more feedback. You can have more time to prepare the application and so on. Last, before finishing, I would like to say that in the case of our group here in Pasteur, in the Genome Plasticity Unit Lab, there is one of the groups, the one of Julia Boss, that works on bacterial response to stress with a special focus on extracellular vesicles, is looking for fellows to actually apply to this MSCA fellowship. So if you are interested, you can look her up. You can drop me an email and I can give you her contact that I just put here just in case. But if in case you forget, please contact me and I will be able to put the two of you in contact. And just before finishing, I would like to thank like all the lab and collaborators that I had during the Marie Curie, and also the GPI AMR and the Marie Curie Actions for their support. And if we have time and you have any questions, I'll be happy to answer them.
Thank you very much, dear Pedro. We will leave the questions for the end, or okay. If you cannot join us for the Q&A question, then I will ask the participants again to write them, and we will ensure that everything is responded to. Thank you very much. It's a truly impressive work that you are doing, and hopefully some of our participants can get in touch with Julia and discuss further. Thank you for being with us today. Thank you for the presentation. I will have to move forward to our next presenter, Victor Surzik from Max Planck. Dear Victor, please connect, introduce yourself, and we are very eager to hear what you have to share with us. Thank you.
Yeah, thank you very much for inviting me. Do you hear me well?
Yes, we do.
Should I share my slides, or you
yes,
share the slides?
Please share your slides. Yes, you have the share button activated. Thank you.
Let's see. See, wait just a second. Maybe I start the presentation first. Yeah, that's one. Yeah. Wait. Do you see my presentation? Somehow I don't see myself.
Yes, we do see the presentation, but it's not in full screen and it's a bit blurry. If you have internet connection technical issues, then we could share it. But let's give it another few seconds and see.
Let me. Yeah, I think maybe if you can share my slides, because I think there is some issue with Microsoft Teams. So it's not a problem with internet connection.
Okay, then please stop sharing and we will share it from our side. You just tell us next slide and we will share it. Thank you very much. Just a few seconds to make this happen.
Yeah, so I guess in the meantime, I can briefly introduce myself. So I am one of the directors at the Max Planck Institute for terrestrial microbiology. And what I thought I'll do is I'll not introduce our specific research program. I'll rather introduce generally the Max Planck Society, our institute, but also a few possible research projects running in our department. And one reason why I'm here is because it was not clear whether our Marie Curie fellow could actually participate, but I thought among the participants that Charlotte is actually also present in the room, so maybe she could be the one if you want to ask more questions later. Okay, so starting with very generally, Max Planck Society is one of the scientific societies in Germany. So since most of you are not familiar with German research landscape, so in Germany you have research at the universities, and you also have research at their academic institutions run by several society, Helmholtz Society, Fraunhofer Society, Leibniz Society, and the Max Planck Society. Next slide, please. Yeah, so Max Planck Society runs a number of institutes across Germany and also a couple of institutes abroad. And our institute is in Marburg, which you see pretty much in the middle of the map here. And the institute, next slide, please, are separated in three sections. That's biology and medicine section, where we are, chemistry and physics technology, and then also the humanities and social sciences section. And biology and medicine section, next slide, please, is split again in several focus areas. So our institute and belongs to the microbiology and ecology focus area, but there is also a focus area on the medicine and infection biology, which is also related to our work. So we are in close collaboration and exchange with other institutes belonging to this section. Next slide, please. Yeah, so our own institute deals generally with questions related to microbiology, interactions of microorganisms, primarily bacteria, but also fungi, to some extent with the environment. And we use both qualitative but also quantitative approaches to solving these problems, including mathematical models. And so I was glad to see also some equations in Manuel's slides before. Next slide, please. Yeah, so we tackle different problems at all levels of microbiology, from elementary reactions and structural biology to processes inside the cells, to microbial communities, and also interactions between microbes and various hosts. So here you see C. elegans and plant, but we also look at the interactions with mammalian hosts, as you will see in there in the next slides. And again, we use a combination of quantitative and synthetic approaches. So next slide, please, again. We have a number of research groups, and I don't show a view of that, so you are very welcome to look at our website. But one thing we are also proud of are facilities we have in the institute, and we are very strong in metabolomics and proteomics assays, but also in the high performance microscopy. That's actually the facility that is associated with our department. So essentially we are running that. We're also doing some methods development in the fluorescence microscopy, and we also have one department dealing with natural product isolation, which is also relevant certainly for AMR. This is the one run by Helge Bode. So this could also be an interest to you. Next slide, please. We are quite international, and this is true also for other institutes in the Max Planck Society. So as you see in this breakdown, more than half of the researchers at our institutes are coming from abroad, and large fraction of them, particularly for postdocs, but also for PhDs, are from other European countries. But we also have many people from essentially all over the world, from Asia and from America as well. Next slide, please. And we also have collaborations with number of pharmaceutical companies, also several startups and patents. We are running as the institute, and I don't have on this slide, but we also collaborate with a hospital here in Marburg and also outside, which is again relevant for antimicrobial resistance research. And again, so we are happy. We don't need to do it. So our mission is doing fundamental research, but we certainly are happy to apply whenever we see a possibility of application of our research in collaboration with pharmaceutical companies, and doing this extensively. Next slide, please. Yeah, so just few slides to what our own department is doing, and where you can find connections to antimicrobial research challenge. We are interested. One of the things we are interested is signal transduction in microorganisms, and so one potential approach to fighting virulence without eliciting antimicrobial resistance is actually interference with the signaling systems of microorganisms, and bacteria have large arrays of the sensory receptors, which are important, many of which are important in virulence, but also in other processes in microbial ecology and interaction with the host. And one of the research directions we have is systematic identification of ligands for these receptors, and this potential also includes identification for antagonists, which could jump the system, essentially blind bacteria, so they are no longer able to sense their host. But again, since in most cases this interference would not affect growth of bacteria, would simply affect their ability to infect the host, we could use these effectors that we identify for suppressing virulence, and this we can do for different mortal pathogens with which we work in our group, including pathogenic E. coli strains, Salmonella, Pseudomonas, cholera, and also Acinetobacter baumannii and Klebsiella. Next slide, please. One of the areas on which we work, and this is our own group, but also a group of Leonid Leganenko in our department, which might also be interesting to you, are bacterial biofilms, and they have been already already introduced by a previous speaker, by Manuel, and we, for example, study biofilms of Klebsiella pneumoniae with one of their so-called escape pathogens, which are highly clinically relevant, but also against Salmonella and UPEC strains, and we do various kind of microscopy assays to study this biofilm, but also flow cytometry and gene expression analysis, proteomics, metabolomics to understand the regulation of these biofilm formations, both in the host tissue or their interactions with macrophages with the host immunity system. Next slide, please. And this is what brought Charolais to our newly started Marie Curie Fellow to join our department. And so what, just in brief, again, Charolais is here. I thought you can also ask her later about the details of her project and her experience. If you're interested, what Charolais wants to do is to establish in vitro model of inner ear infection. And here you have problematics of not only of microbes colonizing their host tissue or host organ, but their complex physical structure. And Charolais is a physicist, where you have spatial organization by bacteria on a surface of a skin, where you have gradients, and we also heard about diffusion of antimicrobial compounds from Manuel before, and you have very similar problematics in the inner ear infection. If you apply antibiotics from outside, then they need to diffuse through this organ and establish a gradient. Next slide, please. So what Charolais set out to do was to establish their biophysical model in vitro of such an inner ear infection, where you have essentially drugs supplied from one side, and then you have glass tube populated with bacteria, and where you have gradients of oxygen and nutrients on top of the gradient of antibiotics. And this, next slide, please, should allow Charolais to address the question of antimicrobial treatment from the biophysical perspective. And this is, again, close to our heart, since we are highly interdisciplinary lab, and I'm myself a biophysicist, where we can combine our and her expertise on biofilm formation, bacterial responses, and using physical methods to measure diffusion of molecules in the biofilm or in this kind of complex physical setup. But then it obviously has a clear implication for practical aspects of treatment in hospitals, because what we learn in the in vitro model can then later be tested in vivo model. And it also has interesting connections with our work on microbial communities, such as regulation of metabolism, quorum sensing, and so on and so forth. Next slide, please. Yeah, so Charolais will use, and I think this is that's general encouragement for you, applying to different places to look at their methodological capabilities of the host group and of the host institute. So she will use the infrastructure we have available here in biophysical methods such as confocal microscopy or fluorescence correlation spectroscopy to address her questions. And the project is truly interdisciplinary. This is an excerpt from Charolais' application. She asked me to include in the slide, and I think this is important for Marie Curie application, that we have multidisciplinary or transdisciplinary approaches combining different expertise, the one you have and the one the host institute can offer to you. Yeah, so with that, I'm finished with my presentation. Thank you. I will not be able to, regretfully, to stay after my presentation, but I could join in the closing session. Maybe you can send me a quick email when how the timing will be of the closing session, of the discussion session, and I'll be able to join if you have general questions to Germany, German research landscape. I will also be happy for people come to Germany, not only specifically to our lab or to our institute, but also to other Max Planck institutes or to other institutions in Germany. So I think I have a pretty good overview who is working where on which kind of questions.
Thank you very much, Victor. Thank you for the presentation. Thank you for your time and your willingness to help everyone and to assist them in their scientific endeavors. And we will again collect all the questions and address you this, I think by email, if the time will not allow us at the end. I would like to invite now Raffaella Vittori from University of Siena, Italy. Dear Raffaella, please kindly unmute and share your presentation with us. Raffaella, if you are with us, will you kindly start the presentation? If not, if you are unable to do this, then we will ask Ana Carolina Ramos. I'm here. Okay, thank you very much. Then will you please kindly unmute yourself? You have the rights to also, you have the share button in the right corner. Open my video and phone. Would you like us to share the presentation? Okay. We will now share Raffaella's presentation from our side. But dear Raffaella, please tell me if you have access to a microphone, because it says here that it is unmuted. It is muted. I have. Now give us just a few seconds to try and unmute you from our side. Probably means that maybe you have to reload. In the meantime, while Raffaella will reload presentation, her browser, I think, on the phone, we will kindly ask Ana Carolina Ramos to deliver and the share button.
Hello?
Yes, hello. Please share your screen, and please, you are welcome.
Okay, thank you so much. All right, can you see my screen?
Yes, yes, thank you.
Okay, thank you. So good morning. Thank you so much for this invitation. As you know, I'm Ana Carolina. I'm a postdoc fellow at Professor Miguel Castanho Lab in Lisbon, Portugal. I'm very happy to be here today to share some of my experience. I'll try to open my video as well. And not only my experience, but also my challenge. I'm not going to talk about my project because Professor Miguel already talked a lot, very well about what you are doing in the lab. But I'm going to share a little bit about my journey and how was it, what I understood about this and my experience, okay? Let me see if I can change it here. Okay. So I'm a Brazilian. The most of my career in antimicrobial resistance was in Brazil. So I did my master's degree there, my PhD as well. During 3 months, I went to Scotland. I went up there to be a PhD visitor as well. I go back to Brazil. I work in a hospital. I also did a postdoc in our university together with a national industry called Europharma. And there I discovered my passion to work with screening of new compounds and drug discovery. But then I moved to work at Pfizer Brazil. It was a very great opportunity for me where I learned a lot. However, even I was in a big pharma in Brazil, something was missing. So the first thing that I believe that we need to understand before to apply for Marie Curie is understand where you are now and what you really want for your career, for your next steps, okay? So when I was at Pfizer, I was not so happy because I was far away of the lab and I was missing so much to go back to work in the bench, to work with discovery of new compounds. And what I knew at the time was I really want to continue to work with antimicrobial resistance. I was doing this at Pfizer, but because in Brazil we don't have the research and development lab, inside of the industry, only outside in other countries, I was not able to work in this area. So I was like, okay, I'm very happy here. I have a very good salary, but I really want to go back and maybe I needed to search for new opportunities outside of Brazil. So was after that that I started to looking for institutions outside of Brazil that could be in the line of research. Sorry. Okay, I'll keep talking. Where I could potentially contribute and add value. So I started looking for institutions. I started to searching for new universities and opportunities that I could apply. So that's where that I saw the Marie Curie opportunity. I think it was in the LinkedIn. I saw a call there and I started to, okay, this can be a nice opportunity. Maybe I can apply. But one thing I think that is very important, it is to understand the guidelines of Marie Curie, okay? Before you think to apply, you need to read a lot. You need to participate in these webinars as you are doing now. You need to know about the structure of the project as well. And also another thing that I believe that is very important, it is to understand if you get the Marie Curie with the host institution, what is the rules, how it's going to be your contract, because maybe you need to be, you need to have a work contract. And when you talk about Marie Curie, everyone says, oh, your salary is very high. But you need to understand that maybe you can have more additional taxes that's going to be inside of your salary. So I believe that everything is very important to understand before. In addition, sometimes when you are going to apply, you need to show that you really want that, and also that you really understand what you are going to do. Sometimes, as someone already said, some institutions have project manager or a grant department that they have a lot of knowledge to help you. Sometimes not. You need you and your supervisor together to have skills to write a very nice project. So in the meantime, when I start to apply and look for institutions, as we already said, right? You need to express your interest. You need to send emails. You need to have new ideas. You need to contact new institutions. And in my case, while I was doing that, I still was apply for other opportunities. I didn't stop. I didn't only have focus in Marie Curie because I really want to go outside of Brazil to work with research and development. So I also was trying other opportunities. So regarding to writing your project, okay, once you find our institution and talk with the supervisors and they accept to help you with this, it's very important to have meetings to discuss, because when you are going to write your project, you need to describe there what will be the methodologies, the equipments. So you don't know a lot of things about the institution. So you need the support of the supervisor, of the project manager to help you to understand what the institution has that can help you in this project. Also be very clear, because when you are going to write some methodologies and you apply for Marie Curie, sometimes the reviser of the project, they don't know a lot about your field of research. So you need to be clear about the methodologies, the future results, the deadlines, and everything that you are going to write in this project. And also what I think this is very important, it is dedicate a lot of time. I think I started to write my Marie Curie project 3 months before the deadline. Was more or less this time of the year, June. And I took some days from my company of holiday to write this and dedicate enough time. But also my supervisors, Professor Miguel Castanho, Professor Ana Salomé, they were very open to help me. So they were in holidays as well, and they were able to read the project and help me with a lot of things. So this is very important. Let me see. Next, and I believe 2 or 3 people already said, and also Professor Miguel, the project itself, it's very important. New ideas are very important, but I believe that when you really put on in your project about the sharing of your skills, sharing of knowledge, what you have that can help this institution to grow, and what the institution has that can help you to grow and increase your ideas and your skills. This is a very important part of the project. I'm a microbiologist, and the most of people in the Professor Miguel lab, they are biochemistry. So it was a very nice opportunity to learn with them and also to share my knowledge in microbiology as well. So you need to really put this in your project very clear. All of your experience, what you have. and your weakness. And the thing is that you can learn with the institution as well, and the other way around as well. So we get the Marie Curie. We got this in the call of 2023. We also have the seal of excellence, and our score were more than 90%, which was really great. But as I said, in the meantime, I didn't stop to apply. So in the same week that I got the Marie Curie, we got this, and we was informed that we have success. I also had the opportunity that I was approved in the University of Oxford to work there. I'm not sure if this is the same now. Okay, you need to check in the deadlines of Marie Curie of this year and next year. But in my time, I still have 2 years to start the Marie Curie. So I applied in 2023, and I still have 2 years to start. So I started last year in September of 2025. Work with Professor Miguel Castanho and Gulbenkian Institute in the University of Lisbon. So just a brief, a lot of people already said how this is important to dedicate yourself to write. You really need to have new ideas because it's a very competitive grant. And also, this part of transfer of skills is very important. I believe that I wrote maybe the same numbers of lines of this part of transfers of skills and the same for the project. I don't remember very well, but I think I was very deep. We were very deep in this part. So this represents a very big part of your project. And also face your fears and challenge. At the time, I was looking for institutions outside of Brazil, and I was looking for an institution in Portugal or Spanish because of the English barrier. And then I could speak maybe Portuguese as well, and Spanish is really close to Portuguese because the English language is still a challenge for me. However, when I arrived in Portugal, I realized that I need to speak English every day. Even the main language of the country is Portuguese, right? So maybe for you, it's another challenge. Maybe it's to move to another country. Maybe it's other thing. But I believe that you need to be prepared for that because when you get the Marie Curie, this improves a lot your CV, and it's going to be very good for your career and for your development as well. So finally, I'd like to say thank you so much, of course, for Marie Curie Actions for this amazing grant. Also for Gulbenkian Institute, for my supervisor, Professor Miguel and Professor Ana Salomé for the support, and everyone and Miguel Castanho Lab. Thank you so much. So please feel free if you have any questions for me or for Professor Miguel Castanho. Thank you very much.
Thank you very much, Anna Carolina. Thank you very much for your interesting presentation. And hopefully we have solved the technical issue with Raffaella Vittori. Yes. Please try to unmute yourself and share the presentation. Raffaella is from University of Siena, Italy, and she will present the host institution. And we also have a fellow, Stefano I hope I'm pronouncing it correctly, Chaco. If not, please correct me. It's also from University of Siena. So please welcome, and we are all eyes and ears, please. Raffaella, can you unmute? If not, then please, Stefano, you can start.
Okay, you pronounced it correctly, my surname. Thank you. Can you hear me? Yeah.
Yes,
okay.
we do hear you. Yes.
Okay, let's try to share the presentation. Okay. Can you see the presentation?
Yes, everything is clear. Thank you.
Okay, perfect. It's a pity Raffaella did not introduce me because she helped me a lot during the preparation of the proposal, but surely if she will be able to join, I will explain everything about University of Siena. So good morning, everyone, and thank you for the invitation. I'm Stefano Ciacco, and I'm from University of Siena. My project was druggability of G quadruplexes promising modulator for resistant bacteria. Before I give just an overview of what was my career path, I'm a biotechnologist with a specialization in pharmaceutical biotechnology with a thesis in pharmacology. And then I decided to change completely the topic of my background, so moving toward medicinal chemistry with a postgraduate master courses in drug design and synthesis in Siena. Soon after, I started my PhD, which was a co-tutel PhD between the University of Strasbourg and University of Siena. And it was a multidisciplinary project combining molecular modeling, biophysics, cellular, and molecular biology. After, actually, at the end of my PhD, I was writing the proposal in between my thesis, and you know, it required 1 year at least for the evaluation. And the first year of postdoc I did again in unrelated and different research field. In the first year postdoc I did in Padua at University of Padua with the research field in neurodegenerative disease. And then very end I received the notification of the MSA in 2023. Therefore, just to say my background was already quite multidisciplinary, and as it was anticipated by Professor Castano, so if I misspelled your surname, the European project tend to select the candidate with already international and multidisciplinary background. So the project was named The Great Escape, and obviously is focused on antimicrobial resistance. You are more expert than me, and you know that antimicrobial resistance is the plague of the 21st century, which require new targets and new mechanism of action. And in this context, G quadruplex, which are non-canonical nucleic acid structure formed in guanine-rich sequences, they can be a favorable target to overcome the antimicrobial resistance, since they can adopt a particular 3D structure which depend by the sequence length and composition. Although these structures have been widely studied in humans, but they are present in all the living mechanisms. And why they are so important? Because biologically, G4 can control replication, translation, transcription, and thus the aim of this project, the Great Escape project, was to aiming to select these sequences inside the bacteria, which are currently the most deadliest and dangerous for the human health, the escape bacteria, and using as a scaffold for developing the new generation antibiotics. Because the idea, if you stabilize enough these structures, bacteria are not anymore able to replicate, translate, synthesize protein, and so on. So just to give some concrete experience, for me, 3 elements are pivotal for the successful MSCA proposal. The first one is the scientific excellence. Obviously, the proposal needs to identify a clear scientific gap. You have to develop a strong hypothesis and objectives that were ambitious but measurable. In my cases, G4 structures are well known in humans, but very little is known in bacteria. And when I say measurable, it's a antimicrobial resistance, it costs a lot in terms of lives and also in money. So if you can provide a compound, a drugs which can solve the antimicrobial resistance, how many lives you can save with this new generation of antibiotics, how much it costs for the society, the antimicrobial resistance, so you can, if you with your research can solve it. And specifically, which is also important, the broadest of your research, can your research be applied to other research fields? Because actually it was my project, it was for human health, but basically bacteria are present in all the research in different research fields, so it can be applied for plants, for the environment, and so on. The second, the host research match. You have to explain why you are the right person, why the host is the right environment, and why that supervisor and network are important for the project, and specifically also for your development. In my case, at the end of PhD, I had a solid experimental background, especially in applied spectroscopy, while Professor Mattia Mori, which was my supervisor during the Marie Curie, is an expert of computational chemistry. So those benefit each other of these different competence. I bring in his lab the experimental expertise, and I learn from him all the computational chemistry. And also, Mattia Mori is still the head of the Cost Action Eurostop, a bottom-up network aiming to boost research innovation and careers with the specific focus on antimicrobial resistance. And also, again, I can benefit of this network. And again, University of Siena, Professor Mori already has all the insight, all the computational experimental infrastructure that I need for the project. And third, also do not underestimate this part for the writing proposal, the career development plan. The MSCA proposal is not only a research project, it's also a career development plan. Those which courses, training can you attend to expand your knowledge, which nectar you can establish during your fellowship. Also the annoying question, where do you see in the next year? So combining all these three, surely it will be a successful proposal. That was a kind of overview of what the project, the Great Escape project was. And I just want to highlight also for the European projects, there is a kind of specific and standard syntax, which is helpful for both sides, meaning when you write, and also the evaluator. Words such as work packages, deliverable, milestone, and risk management, which you should get used it in order to have also not only a successful and safe application, but also for the other type of fund, the DRC and so on. For instance, work packages are the major subdivision of the project. It groups together a set of individual tasks or activities that needs to be completed. In my case, the bioinformatics selection of the sequences, the G4 sequences, when they're produced within the first work package, which is the first set of tasks. Milestone are significant checkpoints in the project that verify the completion of major phases of the project. In my case, the 3D characterization of the selected sequences or the identification of the promising compounds in the work package too. The risk management is the continuous process to identify and analyze and respond to potential impairment that could negatively impact your deliverables and milestones. In my case, before investing machine time to simulate sequences, we decide usually to purchase a small amount to test the folding of these structures and vice versa. So you have always a secondary plan or something to mitigate what can negatively impact your research. Of course, not everything processed exactly as planned in Gantt chart. That was here, there is the Gantt chart of the project, the timeline. It was presented in the proposal, and I said nothing works as we planned. But it's normal in science, and the proposal, the work package looks clean and sequential, but in reality, experimental optimization takes time. So systems, when some systems are more difficult than expected, and some results opened your question. Not all targets behaved as initially expected, and thus there was no need to force the project to follow the original plan. I had to prioritize the most informative systems. Some objectives became deeper case studies, while others remains more preliminary, but must manage it carefully and transparently. especially with your supervisor and the host university. The project also involved reporting, dissemination, communication, and networking. This was demanding, but extremely useful because it trained me not only as a scientist, but also as a project manager. Overall, what I learned as an MCA fellow, I learned to prioritize. It's tempting to include many targets, many methods, many possible outcomes. However, a focused question is stronger than overexpanded project. Unexpected results can become more informative ones. For instance, I have a paper which was just submitted, which is completely based on unexpected data. Develop flexible workflow rather than rigid pipelines, especially multidisciplinary project, since a different approach sustain each other, as I told you before, with the risk management. I learned the importance of communication with supervisors, collaborators, and especially the administration. This is essential when some problems emerge or when reporting deadline is approaching. And in summary, the MCA Fellowship allowed me to develop an independent research line, strengthen my multidisciplinary profile, and generate data that are now supporting manuscript and also future application. Moreover, the fellowship increased my visibility through conferences, and I mentioned it before throughout the network of the Eurostop Cost Action from Professor Mori, which allows me to networking with a lot of collaborators, dissemination activities and interaction with different scientific communities. It also gives me direct experience in manage research projects such planning activities, adapting priorities, communicating results, and think about the broader value of the work beyond a single experiment and publication. And I think this one is what is most pivotal, what I learned the most from the MCA experience. From the take-home message, it's demanding. It's a huge opportunity, and because you are not only responsible for producing scientific data, but you are also responsible for developing a coherent project, managing timelines, communicating results, and adapting to unexpected outcomes, and building your future research profile. It's all on your shoulder. Thus, the MSCA Fellowship is highly transformative. But again, a successful MSCA Fellowship is both scientific project and career development plan. It helped me to understand more clearly how to connect scientific creativity, methodological rigor, and strategic project development. And with this very last slide, I just want to give and highlight what I consider the most important skills at all, beyond also the career development plan and the project management. It's the communication. Interesting project and promising results can lose much of their impact if they are not presented effectively. You need to find a clear and engaging way to communicate your work, capture the audience attention, and make its value immediately understandable. And for me, it was easy to mix together my work and one of my passions, which was Star Wars, and together it became the Bad Wars. And it was cutting, and especially it was helpful when you present something to communities which are not scientific community. It was mentioned before the Bright Night events, which are just not scientists, and you have to get aware about the antimicrobial resistance. And this one can be a step forward to help and to engage them and to present your results and the importance of your results. And with that, thank you for your attention.
Thank you very much, Stefano. Indeed, it was a very captivating slide at the end. And of course, we have to properly communicate our results and science to citizens, to the people that understand things differently. And it is very, very important for all of them to understand the impact of this antimicrobial resistance and the impact that you and your colleagues have in combating this. So we are still waiting for Rafaela to solve her technical issues. And in the meantime, I would like to ask the representative of the Radiance project to connect. It's Jesus, or it's Jesus. I'm sorry if I misspell it. Please introduce yourself, and we're looking forward to your presentation because the MSCA matchmaking platform is a tool that is very efficient and will be very important for those who really want to engage with the fellows and institutions. So I let you speak now. Thank you. And
Hello,
we do see the shared presentation.
Yes,
and we
perfect. Thank you for the invitation. Sorry, I'm actually in Brussels in another meeting, so I will explain my presentation. My name is Jesus Rojo. I'm the national contact point for Marie Skłodowska-Curie Actions in Spain, and I'm going to present you briefly the MSCA matchmaking platform we built in the framework of the Radiance project. Okay, let's see if it's working. Okay, so the MSCA matchmaking platform is a tool for consortium building, partnering selection, but also to promote opportunities for future fellows. But this is focused mainly in organization. The platform is for any entity, companies, university research centers that want to promote the opportunities, the project ideas in different Marie Skłodowska-Curie Action opportunities. How you are going to find partners usually in your daily work through peer collaboration, scientific events, the MSCA Brokerage event. I'm going to present you at the end of the presentation. We are organizing in July another brokerage event, but also you can use the Access network and also the Enterprise Union Network, this initiative in order to find partners for your project, for Marie Curie projects, but other kind of projects. In the framework of the Marie Skłodowska-Curie Action in the Radiance project, we built this matchmaking platform, and this matchmaking platform helps you to find fellows, but also to find other entities to involve in other Marie Curie projects like doctoral candidates, doctoral networks, staff exchange, co-fund, and for sure, postdoctoral fellows. The matchmaking platform will help you to find the best candidates. You can you can register in the platform if you are a supervisor or if you are someone from the European Project Office in a university and you are looking for collaborators, or if you want to promote your hosting offers for, in this case, for postdoctoral fellowship in this new call in 2026. We have several profiles. We have a profile for supervisors, profile for research organization, for universities, for companies, for NCPs, for EURAXES, and also for the Marie Curie alumni. So the platform helps you to create your profile and show your expertise, your needs, or your project idea. You don't need we don't allow fellows to register, but you can check the platform. You can get inside the platform and you can navigate and you can find hosting opportunities from different entities. This is how it looks, the platform. Also, we publish YouTube a video explanation how to register in the platform. It's very easy. You can register, you select your type of entity. If you are a supervisor, if you are a university, if you are a research center, a company, a hospital, etc. So you register and you include all your details. And after you register, you need to include in the marketplace an item. It could be a request, like you are looking for fellows, you are looking for a company specialized in a specific topic. You can offer you can showcase your expertise. For example, if you are a supervisor, you can explain here in the marketplace that you are working on cancer and your expertise is this and that, and you can showcase your experience in research. But also you can explain and you can publish a project idea. You want to participate in doctoral network and you want to participate in pollutants in the environment. So you can create here a project cooperation, a project idea. After you register yourself and at least one item in the marketplace, our team will validate. And after the validation, you can navigate and you can book meetings with other entities, with other supervisors. So it's very easy. And we validate every day those participants with an item in the marketplace. So here you can see we have 90 NCPs. So you can contact your NCP in your country, or you can contact other NCPs in other countries in order to help you to find someone, for example, Tubab from Turkey, or Sandra from Zagreb. We have Corina from Romania, or Anahit from Armenia. If you want to book a meeting with them, you can register and book a meeting and have a one-to-one meeting without any external program. So the platform has internal one-to-one or one-to-many technology for meetings. Also, you can select the supervisors by country, by type of entity. So here I select the Spanish supervisor offering their expertise in order to receive future fellows for postdoctoral fellowship. So it's very easy to navigate. Also, each supervisor, they can explain about themselves, their institution, but also they can explain their expertise or the project idea. So the information looks like this. It's very easy and very appealing for candidates. Also, you can register your organization. For example, this example, the Durham University as an institution, they can register their profile, they can showcase different expertise. Or, for example, in this case, in the marketplace, they are hosting Marie Skłodowska-Curie Actions Fellowship, so they can provide this information. And also, you can navigate in the marketplace. You can check if someone is offering their expertise for the staff exchange call, postdoctoral fellowship, co-fund, citizen, doctoral network. So it's very easy to can connect with. As I repeat again, this is not for fellows. The fellows can use the platform with registering. So you can navigate and you can find supervisor for your proposal. So many of you register and we informed you that this is only focused this period for institution. So here you can see the marketplace, the different opportunities. So day by day, participants, they are including new opportunities for you as a future postdoctoral fellow, but also if you are a university and you want to involve other university in a doctoral network project, this is the place. But also, we are organizing yearly brokerage events. So next 15 and 16 July, we are organizing this doctoral network brokerage event. It's a virtual brokerage event. You have here your the link, and the link will help you to register your institution. You can also register with a project idea and with an expertise. So during 2 days, you will be able to book meetings and to have one-to-one or one-to-many meetings with other entities in order to build a project in doctoral network call. So if you are interested in this call, this is the opportunity to connect with other entities worldwide. So we are expecting to have organizations from Europe, from Asia, from Oceania, from Africa, and from America. So just click on the link and register, include a marketplace item, and we will validate you, and you can navigate and you can ask for meeting to other participants. So thank you. This is our link or Radiance project. In the Radiance project, you can find a lot of information. We just published the handbook for postdoctoral fellowship. The handbook for postdoctoral fellowship is a document that helps you step by step how to prepare your proposal in all the section with advice, with information, with description. And this is the document you need to use to prepare a successful proposal for, in this case, for postdoctoral fellowship, but we publish handbooks for all the Marie Skłodowska-Curie Actions in the program. Thank you.
Thank you very much, Jesus. Thank you. It was very, very useful. Sometimes we feel that 15 minutes is not enough, but we have to move on. We have another speaker. Thank you very much for your support and for the wonderful platform that you built. It's indeed of very important, of very much help for the beneficiaries. Then thank you for your time today.
Thank you. Bye-bye.
Yes. So bye. So now I will ask our last but not least presenter, in case that Rafaela will not be able to join, Sophie Achemian from the Global Project. She will talk about building stronger research partnerships. Sophie, if you are here, please, you have the right to unmute yourself and to share.
Hello.
Yes, we hear you.
Yeah, you hear me, and sorry, I will start. Do you see the document shared?
Yes, we see a screen. Yes, now we see the.
Oh no, okay, I'll change. Just a second. Yeah, you see?
Yes, now we see.
Can I start? Okay.
Yes,
thank
please
you very
do.
much. First of all, thank you for organizing this event. This is amazing and very important event. And thank you for the opportunity you gave me to represent the global MSCA. I will talk about I'm Sophie Achemian. I'm the Regional Liaison Officer for Eastern Partnership and Ukraine of Global MSCA. I will talk a bit about global project and then about doctoral networks, MSCA. Global project is the EU-funded project called MSCA Global Cooperation Policy Enhancement and Strategic Promotion. It supports and expands international participation in MSCA research funding schemes. We mainly focus on three activities. It is policy analysis. We study how countries and institutions participate in MSCA and identify barriers and opportunities for collaboration. The second activity is promotion and outreach. We help researchers and organizations learn about MSCA funding opportunities and how to apply. We help to understand how to apply. And the third one is strengthening synergies, align MSCA activities with other EU research and innovation initiatives for maximum impact. The geography of Global is 20 countries. So we work with 20 countries and 6 regions. You can see them on this slide. And I'm personally RLO for only Eastern Partnership and Ukraine. And each region has its RLOs, or maybe one RLO is covering 2 regions. Sorry. Okay. The impact that we expect that Global will deliver improvements in international research collaboration, strengthen Europe's position as a global leader in research excellence and innovation. You can get involved with Global if you are a university, representing university, research institution, or you are individual researcher interested in MSCA funding. And also we would like to have contacts of NCPs, as earlier of my region, EUP and Ukraine. I have all contacts, but if there are participants in this conference that can that would like to be also included in our stakeholders list, that please write. I will give you email in the end of the presentation. So why is MSCA important? I'm sure that this is maybe I can pass this slide because everyone knows that it is truly global, excellence-driven, partnership-focused, and it makes what makes MSCA unique that it is bottom-up and flexible, international, intersectoral, interdisciplinary. It is for all career stages, attractive. It has attractive conditions, industry-friendly, excellence, and values excellence and impact. And I will tell about features that benefit organizations for academic institutions. These are that they can attract and retain top talent, enhance international reputation, build strategic partnership, develop institutional capacity. For non-academic organizations, it is access to cutting-edge research, innovation, technology, transfer, and developing R&D capacity, and of course, connection with academic expertise. Here is the fact that Philip Agion, who participated in Staff Exchange 2 programs, is also a Nobel Prize winner, which is a huge, I think, benefit for MSCA, and it is thing to be proud for MSCA that the participant of the program actually has Nobel Prize. And a bit about doctoral networks, just shortly to remind that the call closure is on November 24, 2026, for all the interested doctorate candidates or organizations who want to participate in doctoral networks. So this network will implement doctoral programs by partnerships and of universities, research institutions, and research infrastructures, businesses, including SMEs and other actors from different countries across and beyond EU. Doctoral networks are open to the participation of organizations from third countries in view of fostering strategic international partnership for the training and exchange of researchers. And the budget for 2026 is 593 million euros. And as I mentioned, this call closes on 24 November 2026. And the mobility rule that doctoral candidates must not have resided or carried out their main activity more than 12 months in the 3 years immediately before the recruitment date in the country that will host them. And I would like to tell a bit about the new part of this call. It is a new program, RAISE. It is for the projects which aim to apply AI in their scientific research, and for those focused on developing new AI tool systems and methodologies. The budget for this specific program is 30 million euros, and the deadline for applying is also 24 November. And how you apply? You just apply for the doctoral network, and if you have interest in declaring the AI part of your project, you just will be able to declare your interest during the application stages. MSCA participation benefits are for researchers, of course, fully funded PhD, international mobility, etc. For organizations, these are universities, research centers, companies, NGOs. It is access to excellent talent, enhanced research capacity, strengthened proposal writing and project management, innovation boost, and etc. Here I have the typical example of the doctoral position in Euraxis, which is offered in Euraxis in the framework of MSCA. So you can get familiar if you wish. And thank you. Here is my email. I hope you see that. I will also write it in the chat. If you have any question, you can write and I will answer. Thank you.
Thank you very much, Sophie. Thank you. We really appreciate what you are doing, and I'm sure that participants are also happy to learn new things, and not just the raw information, about the calls, but to actually see that there are projects and there are people who are there to help them to actually create these partnerships. And thank you very much for your time today. And hopefully they will contact you in case they have other questions. And we are very glad to also meet you today. And I'm happy to thank you. Yeah, I'm happy to announce that Rafaela seems to have to be able to also share the presentation and to participate. Rafaela, please try again. You should be able to share and unmute yourself.
Yes. Good
yes.
Morning, really, I'm
finally.
sorry.
Yes.
And I apologize with all the audience. It was a technical problem, but now here I am. So thank you for waiting for me and giving me the opportunity to keep on with my presentation. So I'm trying now to share. Just give me, okay, a few seconds. Can you confirm?
Yes, we can see it. We can see it and share in we hear well. Yes, please go ahead.
Okay.
Thank you.
Okay, very good. So good morning to everyone. My name is Rafaela Vittori, and I'm glad to be here and really appreciate and thank the National Contact Point for inviting me. I'm not a scientist, I'm not a researcher, so mine is a different perspective as I'm an administrative manager and the head of the International Research Office. So the idea is to give you a practical overview of what it could mean choosing University of Siena, my organization, my institution, as your host institution for the current postdoctoral fellowship call, or even for future call, as current deadline is quite approaching. Deadline is on September the 9th, and the MSCA PF scheme is exceptionally competitive, and so co-writing a high-quality proposal requires a significant time investment from the applicant, the supervisor, and the host institution as a whole. So maybe it won't be this year, but let's keep in touch even for next year. This is a yearly call that the European Commission always published. So just short presentation of my institution. The University of Siena was founded in 1240, so it's one of the oldest European university based in a small, beautiful town in the center of Italy. We are a comprehensive university with a broad scientific offer that goes from chemistry to history, from biology to law, and so on. And we are devoted both to teaching and research mission. We are now currently managing over 60 international research projects, and we have a portfolio of 200 funded international projects over the years, even by European Commission or other international organization entities. We have secured over 25 million in international research funds, and at national level, we are classified as a small medium university with our 1,700 students per year. But our commitment in building qualified scientific networks and attracting talented students is really high. Try to go fast into my slides. This is just a screenshot I took from the funding and tenders portal from it's an automatic generated by the dashboard, and it could represent some of our funded research areas over the years. This is quite important. I think it could be interesting for you, as our university has several connections and networkings on a different level. Just to name a few, I could mention our participation in the Coimbra group, as well as in PRIMA, Partnership for Research and Innovation in the Mediterranean area. But in this case, I would like to underline a quite recent achievement, that is to say the collaboration with the Biotechnical Foundation in Siena. This historical link between Siena and vaccines dates back to the first year of the previous century, and it is still very alive. This is a hub of excellence that sees Siena, University of Siena, and Fondazione Biotecnopolo at the forefront of studying new vaccines and antibodies against antimicrobial resistance. We signed an agreement together 2 years ago in 2024, whose main aim is to provide intellectual, educational, technical, instrumental resources to enhance research and establish strategic alliances for higher education. So please pay attention to this specific connection we can hear. Here you can, this is a link I insert in my presentation, several links related to our institutional website, just to make you go deeper later if you have if you're interested in. And most of our founded projects are described here in a specific session, and maybe you could be curious to serve it, so I leave it the link. Let's look now to our experience within this specific program, MSCA. We have several projects funded over the year, and specifically 11 postdoctoral fellowships, 16 doctoral networks, and 8 staff exchange. This track record is a guarantee that our administrative offices are familiar with specific reporting, management, and even co-writing, only with in particular reference to some parts of the proposal or the application that this kind of fund requires. Here, as I told you before, some links to our founded project with regards to life sciences, but you'll be able to see this more deeper. And this is just enhance on a policy perspective. UNIC holds the HR, Human Resources Excellence in Research label achieved in 2022. This certified our recruitment processes are open, transparent, and merit-based, and that we are committed in implementation of the European Charter for Research. And furthermore, we have a fully implemented gender equality plan to ensure a supportive environment for all researchers. This institutional identifiers labeled are kind of mandatory details you are invited to include in your proposal to demonstrate that you will be working in a professional, ethically sound environment. Now, moving to the practical support you could receive at our organization, we provide an institutional framework divided into the specialized unit. So the International Research Office and also the IPR liaison office can offer you a guidance on financial, legal, contractual matters, including assistance with budget preparation and Horizon Europe compliance. Of course, not in Marie Skłodowska-Curie Action, where budget is very simply it is based on a unit cost approach. Now, for foreign candidates, I think it is also very interesting and primary that we host a Euraccess Center in our university that can help you and provides you dedicated support for integration into the city, assistance with visas and medical care, and help researchers and also their families settle into Italian daily life. Library services, and of course also our communication and public engagement unit, as this part is very pivotal to your MSCA application, as you are asked to promote and disseminate your project idea. Okay, now here we come to our training offer for researchers, which I'm particularly proud of, as we are now able to guarantee every year a organized training plan. Starting from last year, March 2025, our national contact point for Horizon Europe, APRE, which is the Agency for the Promotion of European Research, has organized in cooperation with our university and also with the other universities of our region, a yearly calendar of 10 training courses, free, dedicated to our professor, researchers, postdocs, PhD students, and also research managers. And so this is a good achievement, and it could be very interesting for you to be included in the section of the two-way transfer of knowledge of your application. Okay, currently the hosting opportunity of at our university are quite brightly promoted through some hosting offer. So we have published it in different platforms, of course, Euraccess and EU funding portal. And here you can also find a list of potential supervisor, even if please note this list is not exhaustive, sorry. So please double check also the links I provided here and highlight the department that are more closely linked to the AMR thematics, which are our Department of Medical Biologies, Biotechnologies, the Department of Biotechnology, Chemistry, Pharmacy, and to some extent, also the Department of Molecular and Developmental Medicine. Here are also some link to presentation video. Okay. After a kind of general overview of the services we can, the support services we can offer you, in this kind of call, I think it is important also to focus on the quality of the supervision, as it is not enough for the supervisor to teach you, but during your fellowship here to share with you some steps, but you must clearly define what knowledge you are bringing to NICI and what is the really center of this connection and of this mutual growth. This section is very important and critical for your evaluation score. So here I provide, going quite fast in this part, but provide a short analysis of connection in Form A, which has to be edited online in your application, and also in the section of the Part B, particularly focused on supervision and on capacity of the participant organization. Because it's very important that you will co-write and share this part with your supervisor while drafting your proposal. As a best practice, I would like also to refer to our Seal of Excellence initiatives. Short step back, what is the Seal of Excellence? So even you know that your proposal should reach at least 70% score just to be considered for funding. If you reached a higher score, so higher, equal or higher than 85%, you are awarded with the Seal of Excellence, which is a quality label that recognizes the high value of your project and facilitates the access to alternative funding sources at national or regional level. So the European Commission, due to budget restriction, can't fund your proposal, but gives you a quality label that maybe you can use in different contexts. And our university in the past few years, unfortunately, it's no more active with this initiative, but and also the national recovery funds, they both provided some funds, specific funds, recognizing Seal of Excellence owners and giving them specific fellowship. currently, which is a big and brand new initiative this year, and it's currently open. Regione Toscana opened a call to aimed at Marie Skłodowska-Curie Postdoctoral Fellowships last year, Seal of Excellence owners that had choose, in this case, University of Siena as host institution, and now it's open, so we have to see if we could get this fund and go on with our researcher idea and implement it. I think I can leave you with some tips from a research administrative manager side. There are general tips on on your proposal. So please, we really strongly recommend to search in the Cordis portal, which is a kind of repository of all research projects, or all funded research project by European Commission, to ensure your project doesn't overlap with previously funded ones. And this is fundamental. Then our recommendation, please pay close attention to the official European Commission lexicon. You can find it, which is all listed. You can find all the definition at the beginning of part B, but specifically make sure to distinguish between some words that at the very first sight would seem could sound similar, but they are not. And this is kind of common mistakes we see in while we are pre-screening the applications that some researchers can send us. Then there is a really unofficial but incredibly valuable guide prepared by many European national contact points, which is the MSCA Net Handbook. And at the very last, sorry, not so last, I would like to describe you specific pre-screening service. As a member of APRE, so the Agenzia per la Promozione della Ricerca Europea, our national contact point, UNISI can facilitate a free pre-screening of your part B. Please note that this check is limited to 1 review per application. So it's not a go and back, but you will receive only 1 review. So your proposal should be quite well defined when you send to the APRE screening service. But in order to do this, we have to, of course, be in touch before. You have to have a sort of green light from your supervisor after his or her rigorous preliminary evaluation of both your CV and of your project idea. Okay, here I leave you all our contacts. So please feel free to contact us. And if you are planning to submit a proposal and application within this current year call, please get in touch with us as soon as possible.
Thank you very much. Thank you very much, Rafaela, for your presentation. And we're very glad that you could deliver it. I'm sure the participants also liked the information, and I'm sure it will be very informative and important for them. So we are now past our timeline, but still maybe if the participants have, we could accept 2 or 3 short questions. We have here with us Miguel from University of Lisbon, Sophie from Global Project, Stefano and Raffaella from the University of Siena, Italy. Otherwise, if there are other questions, then I will kindly ask you to address them in writing. We will follow up with an email to all participants and speakers. And of course, we will strive to, so everyone has all the information needed to make it to a successful application. So if there are very urgent questions, 1 or 2 we could take, please raise your hand so I can see you. Otherwise, yeah, you can write them to us. Okay, let's wait a bit more. I don't have any raised hands. All right, I don't see any raised hands. Indeed, there is the information was so overwhelming even for us. Thank you very much to all participants, to all speakers. I'm sure it was very informative. Let's now take some time to analyze everything. We will email everyone the presentations. You will have still some time to go through it, to analyze, to reflect, to take into consideration all the valuable advice that has been given by the host institutions and by the fellows that were successful. And we will definitely keep in touch with everyone. And in case you have requests, please don't hesitate to write us, and we will do our best to answer everyone. So thank you very much again for all your time, and I can now declare this meeting over. So have a nice day, everyone.
Thank you.
Yes, thank you. Thank you all.
Thank you very much. It's been a nice presentation.
Thank you very much for the